Hello, my name is Dr. Roger Kasendorf. I'm a physiatrist over here in La Jolla on the campus of Scripps Memorial Hospital. I specialize in physical medicine and rehabilitation and pain management. So I was in my second year of residency, and I was seeing this one gentleman who was coming in with some low back pain. I did my full assessment. I came back to my attending to present the case to him and give my recommendations. After I did this, I said, you know what, I think we should start some physical therapy. And then my attending said, okay, so what are you gonna do for him? And I said, well, I just said I'm gonna get some physical therapy. No. Do something. What are you going to do differently that any other doctor is going to do that's going to distinguish you from anybody else? So I said, what do you mean by it? He goes, doctor, you're a DO. You could do manipulation. You could do some stretching. You could give him a trigger point. You could give him a hot pack. Do something that's going to make the person feel better leaving than when they came in. And this has kind of been my philosophy going forward in this regard. This is why when somebody comes in, let's just say, for instance, someone comes in with some elbow pain. Now, this might be a case where regularly someone might just be prescribed an anti-inflammatory and then on their way. But you know what? They're in the office, they've paid for the parking, they've waited in the waiting room. Let's do something. Okay, you're having some elbow pain. Let's take a look right now with the ultrasound. Let's see what's going on. Okay, I see there's a problem there. We could do some taping, we could do an injection, we could do some stretching. There's so much that we can do for each person, and I try to make every single office visit being that individual treatment case. In some cases, we may need to do electrodiagnostic testing, and this can also be done in the office. So when it comes to patient care, I try to be as empathetic as possible, and I think about where the patient's coming from. They're coming in for a reason, they're having pain issues. I want to make sure I take care of everything quickly, efficiently, get them on their way as soon as possible. A lot of this may involve diagnostics, which includes electrodiagnostic testing, ultrasound. I also like to provide a full treatment plan for when they're there. And not only full treatment for the plan of the day, but what are we going to do next time? If this doesn't work, well, what's the next step after this? If that doesn't work, what's the step after that? And if I don't know, you know what? I look things up, and that's okay too. And do I refer? Of course, if need be. But the ultimate goal I have is to avoid surgical intervention, decrease pain, improve function. To do this, we have so many different modalities that we can use. Are medications necessary? Sometimes, but we try to avoid this as well. If someone should have a need for a certain type of treatment, that's okay too. The way we work in our office, we work through referrals only. So you will need to get a referral to come see me. We do this for multiple reasons, but this is to ensure that the people coming to see me are really there for a specific purpose and to make sure we're getting exactly what we need to deal with. So if you'd like to come see me, please ask your physician to send a referral over to our office. We'll be very happy to see you.